the efficacy of MDT on lateral epicondylalgia, not just general elbow pain. So we just walked 3 of those patients out that had either fit the diagnostic criteria that randomized control trial used, or had a medical diagnosis and also fit the diagnostic criteria of LE or lateral epicondylalgia. In the paper, this is acronym just LE, which is a little easier to say, so maybe we refer to it that way.
I like that.
Have an easier Thursday night here. Yeah, so that was kind of the premise of it. I've always been a little interested in the elbow. I don't see it a lot. It's like one of those just weird joints like TMJ that you get, or I get at least here and there, that I was interested in pursuing. And just there's something about that randomized control trial that just really stuck with me. I was like, how can that be that it's, you know, a form of treatment that I think is pretty good and it makes sense and they're doing a little bit more than the average person, isn't yielding effective outcomes. It was just embarrassing almost. And I said, we need to show something better. Yeah. So that was the premise of why it started. And then, yeah, I guess if we just kind of get into the paper, I'll just walk through the different sections of it. So in the background of it, you know, looking into lateral epicondylalgia, I forget the timing of when this happened, but it used to be called lateral epicondylitis, implying that it's an inflammatory state of the tendon. There's been a lot of research out there that has negated that. Histological dissection that looks at people with symptomatic LE, and there's no inflammatory cells. So the use of inflammatory treatment doesn't make any sense because it's not an inflammatory state. So, and why you see this high, I think at least, this higher recurrence rate in people that have cortisone injection. Because cortisone is good at killing inflammatory cells, but it eats away at other tissue. So if you weaken the tissue, of course it's going to fail. So if you're really looking at that research, I think it's really interesting, that whole histological dissection and not finding inflammatory cells. And because of that, the name was changed to lateral epicondylalgia as just a generalized term, and it's mostly implied that is a degenerative tendon. So it's a tendon issue that was injured, that has since healed improperly, or over time has just become weakened and then causes dysfunction and pain with different functional movements.